Is assisted living really cheaper than a nursing home? The answer might surprise you and save you thousands of dollars every single month. So let's break it down. When it comes to the cost of care, assisted living is generally significantly cheaper than a nursing home. But the difference in price really depends on the level of care required for your loved one and the specific facility. Assisted living is for individuals who need assistance with their ADLs, activities of daily living. Things like bathing, dressing, taking medication, preparing meals, eating meals, brushing their hair, brushing their teeth. Those are the things that they need help with, but they do not require around-the-clock medical care. The cost of assisted living typically covers room and board, personal care services, and access to amenities like social activities, housekeeping, and transportation. The average monthly cost of assisted living varies by location, but it tends to be much more affordable than a traditional nursing home because the level of medical care that's being provided is just lower. The price for assisted living is often based on factors like the size of the home, the location, and the services provided. Nursing homes provide 24-hour medical care, and they are for individuals who have serious health conditions such as chronic illnesses or disabilities, or people who require constant monitoring and medical attention. Nursing home costs reflect that extensive medical care that's being offered there. And, they also include nursing staff, physical therapy, and specialized treatments that assisted living homes do not. The higher level of medical care makes nursing homes more expensive than assisted livings, with the price really varying based on the level of care needed and the home's location. Some individuals may face additional costs for specialized treatment or therapy services, and this is why there are major differences between the pricing. It's not just a bedroom that you're paying for. The amounts of care and attention that someone needs plays a very significant and great role in how much it's going to cost them to stay in any type of assisted home, whether it's a regular assisted living or a true nursing care home. To learn about how to get started in the residential assisted living industry, I made this video to walk you through those next steps. So check it out next so you don't have to stop the learning here. The cost differences between assisted living and nursing homes can be significant, upwards of a few $1,000s a month different. But it's important to consider the financial support options that may be available to you. Many people use long-term care insurance or Medicaid to help cover the cost of a nursing home. To use Medicaid, individuals must meet both the financial and medical eligibility criteria. Medicaid will generally cover the full cost of nursing home care for any eligible individuals, including room and board, personal care, and medical treatments. However, some states have different Medicaid programs or may provide additional services, so it's important to check with your local laws. The nursing home itself must be Medicaid certified, meaning it meets certain standards required by the state and federal government to receive that Medicaid reimbursement. While Medicaid can help cover some of the costs associated with assisted living, the level of coverage varies by state, and certain conditions must be met to qualify. Individuals considering Medicaid coverage for assisted living should really research the specific Medicaid programs available in their state and consult with a Medicaid representative to make sure that they're eligible and fully understand the extent of the coverage. Long-term care insurance can provide coverage for both assisted living and nursing home costs, but policy details really vary greatly. Policyholders should carefully review their long-term care insurance policy to understand what is covered and what is not. They should also consult with an insurance provider to ensure that assisted living or nursing home expenses are included. If you don't have a plan for how you want to pay for your care, it's time to start planning or create your own care home where your loved ones could live for free when that time comes. Check out this video here to learn how to dive in on that next step right here on YouTube.